Nursing 474, Promoting Health Through Healthy Communities and Cities. The weekly learning objectives include choose a community health diagnosis for your community's problem, organize a plan for a community health wellness plan, choose appropriate goals from Healthy People 2020 for the community health care plan, collaborate with members of the community to diagnose, plan, and formulate goals for a community health wellness plan. History of Healthy Communities and Cities movement. The Healthy Communities and Cities movement began in 1986 with the World Health Organization. This was the first worldwide action plan for health promotion that declared the following broad categories as prerequisites for health: peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice, and equity. It is now an international movement involving thousands of cities. It was initiated in the United States in 1988 with Healthy Cities Indiana and California Healthy Cities Project by adapting the European experiences to the American context of localities and not just cities. The Healthy People 2020 process is consistent with the way in which health communities and cities have developed their priorities and plans. A major goal of Healthy People 2020 is to create physical and social environments that promote good health for all, relying on the ecological perspective that says that health and health behaviors are determined by many influences, including personal, organizational, environmental, and policy factors. So you do need to know some definition. There are many definitions of a healthy community. The Healthy People 2010 document described a healthy community as one that included those elements that enable people to maintain a high quality of life and productivity. The Center for Disease and Control Prevention, the CDC, defines a healthy place as one that is designed and built to improve the quality of life for all people who live, work, worship, learn, and play within its borders, where every person is free to make choices amid a variety of healthy, available, accessible, and affordable options through collaborations, partnerships, diverse and extensive citizen ownership and partnership in the process. Instrumental to this movement were the principles of primary health care, equity, health promotion, community participation, multi-sectoral cooperation, appropriate technology, and international cooperation. Primary health care refers to meeting the basic health needs of a community by providing readily accessible services. Because health problems transcend borders, international cooperation is important to ensure health. Equity implies providing accessible services to promote the health of populations most at risk for health problems. For example, the poor, the young, older adults, minorities, the homeless, and immigrants and refugees. Health promotion and disease prevention focus on providing community members with a positive sense of health that strengthens their physical, mental, and emotional capacities through community participation. Multi-sectoral cooperation is the coordinated action by all parts of a community, from local government officials to grassroots community members. Appropriate technology refers to affordable social, biomedical, and health services that are relevant and acceptable to individuals' health needs and concerns. Assumptions about community practice. Rothman and Troutman's essential models for community practice are locality development, which is a bottom-up approach. It is a process-oriented model that emphasizes consensus, cooperation, and building group identity and sense of community. Social planning stresses rational empirical problem solving, usually by outside professional expert, and does not focus on building community capacity or fostering fundamental social change. And social action, which is bottom-up approach, is also a bottom-up approach, and it aims to increase the problem-solving ability of the community with concrete actions that attempt to correct the imbalance of power and privilege of an oppressed or disadvantaged group within the community. Healthy Communities and Cities in the United States. The CDC's Healthy Communities program emphasizes policy, systems, and environmental changes that focus on chronic diseases and that encourage people to be more physically active, eat a healthy diet, and refrain from using tobacco. The CDC Community Health Promotion Handbook contains 5 guides from the Task Force on Community Preventative Services that build on the socio-ecological model, dividing the environment into 5 areas that affect health behavior. They are individual, interpersonal, organizational, community, and policy. Each community is different, and its challenges, goals, resources, competencies, problem-solving skills, and practices are different. The National Civic League's 5 principles for application to community work include a broad definition of health to address the root cause problems, a collaborative, consensus-based approach to problem solving involving a diverse group of citizens, and assets-based approach to problem solving that defines people and relationships by their skills and abilities rather than needs and deficits, addressing challenges at a system level and creating a shared vision for the future that captures hopes and dreams of the community and guides collaborative work. Other useful principles include the whole is greater than the sum of parts. A change in one part of the system affects the others. Collaboration is central to the development of a healthy community, and all the systems have feedback loops. Collaboration can help make the best use of resources, reduce duplication and competition, increase effectiveness, develop more sustainable resources. Collaboration involves doing things differently than in the past and developing different kinds of partnerships and relationships. Organizations that work effectively together have generally achieved 3 things: high levels of trust, serious time commitment from the partners, and a diminished need to protect their own turf. Collaboration requires the same mix of behaviors and goals as those associated with the development of healthy community. Models for developing healthy community. Although there are many models to guide the development of a healthy community, they do have considerable amount of commonality. The PAOS HMC model is a 12-step process, and they are listed on your slide. The Indiana University Community Health Promotion Model is a 9-step model, and they are orient the community, build the partnership, develop a structure in the community for health promotion, determine who will lead the health promotion work, assess the community, plan for the community-wide health, develop community action for health, provide information based on data to policymakers, and lastly, monitor and evaluate the progress. Nurses may work with the healthy community process in a variety of ways and in many stages. The ultimate goal is to promote the community's own leadership for health and not do for the community what it can do for itself, but work in partnerships with community leaders.